am Dr. Kimberly Erickson. I am one of the pediatric surgeons on staff here at NC Children's Hospital at UNC. If your baby has an abdominal wall defect, I will be one of the physicians caring for your child during their hospital stay. Once your baby has been stabilized and is in the neonatal intensive care unit, the surgical team will assess and decide what kind of abdominal closure is best for your child. A small percentage of babies will have the intestines looking fairly healthy and fairly small. These babies can have the intestines placed gently back into the abdomen at the bedside in the intensive care unit. This does require some medicine to relax the baby's muscles and to keep them very pain-free, but can be performed right at the bedside. In these cases, all we have to do is put a small bandage over the belly button area when we're finished and let the baby heal. Surgical closure of the small hole in the belly wall can be delayed and treated very similarly to a belly button hernia. The large majority of infants with gastroschisis do require a more staged procedure to get the abdominal contents or the intestine back into the belly. What we normally do is we use a silo or pouch to place the intestines to cover them, protect them from losing heat and moisture. This silo is tucked very carefully under the abdominal wall, and then the silo itself is hung up from the baby's isolette where they lay during their stay. This allows gravity, as well as ourselves, to carefully, slowly reduce the intestines back into the belly. This can take approximately 5 to 7 days, although it changes for every baby. Once the abdominal contents or the intestines are reduced into the belly, then we have an opportunity to close the abdominal wall. The abdominal wall closure is a surgery that does require a trip to the operating room. Your baby will receive general anesthesia, which will allow them to be completely asleep and not feel anything. At this time, we will take out the silo and we will carefully find the hole or the defect in the abdominal wall, and this will be closed using some very strong sutures. After closing the deep layer, the strong layer of the abdomen, we will create a new belly button using the skin. There's a very small percentage of gastroschisis babies who require a placement of a temporary mesh because the abdominal wall hole is a little bit too big. This mesh can be left in place and allow your baby to go home and be removed at a later time when the abdomen or the belly has had a chance to grow. You will be able to see your baby in the critical care unit as soon as the nurses have communicated with the anesthesia team and have checked to make sure your baby is nice and stable.